We just want to be really good at what we do. But I do find that there are definitely some that you can see their passion, you can see the drive and how much it means to them to focus on holistic. And I say go for it. If that makes sense for your practice, you will find patients that align and your business will thrive because you believe in it.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Jennifer Cobbs, who is a board-certified physician assistant with over 18 years of experience. She's the lead injector at SkinCeuticals Skin Lab Atlanta, where she is known for her full facial assessment and curated treatment plans for her patients. Jen is also a highly sought-after national trainer for Allergan Aesthetics, where she travels across the country teaching injectors. In 2023, she was in the top 4% of the most utilized Allergan trainers in the US. So Jen, welcome. It's a pleasure to have you here.
Oh, thank you so much for having me.
Yeah, so let's dive right into it. How did you get interested in aesthetics?
It's a really funny story. I feel like it's one of those things that kind of came pretty natural to me. I grew up with a fine arts background. I actually was very much into arts and music growing up and attended a school that specialized in that. So when I went to college, I don't know what in my mind said, I'm going to med school. I'm going to go medical. And that was kind of my thought. And I really didn't think about it. But once I went to physician assistant school and I got into obstetrics and gynecology, I realized that something was kind of missing. So I actually kind of fell into aesthetics. It literally was someone mentioning that I should consider it as a part-time job, and then it became my career path. So just like that, life changed pretty quickly.
Oh, wow. So after you got into aesthetics, how did you end up setting up shop with your own practice skin lab?
Yeah, that's been a bit of a journey. So I worked a lot with plastic surgeons and kind of worked with doing aesthetic treatments, but also doing surgical first assisting because that was kind of like my craft or my path of getting in. And after a while, I just started realizing that this field is so like vast and there's so much you can learn and grow. And being a trainer for Allergan really opened the door for me to see that business opportunities were out there. So I kind of just took that path and really dipped my toe in it, doing like trainings and private trainings. And then eventually I started thinking, I could probably work as a business. I could do this. I just need to like get this, the things together. So after a little practice, I kind of started working as a 1099 and then it just took off from there. Business just grew.
Oh, wow. That's incredible. So when it comes to your practice, can you discuss some of the most popular treatments that your patients come to you for? And also, why do you think that they're so popular?
Yeah, honestly, I treat a lot of patients that are very new to aesthetics. I think that's one of the things that I've focused on is that, we can all look and feel our best. And I think a lot of patients focused on feeling like they look sad or they look angry or, they just look tired because life is hard, right? So for me, that's been why it's so focused on like things like Botox and doing skin treatments to kind of really just rejuvenate the skin. Dermal fillers are great because they give instant gratification and every patient loves instant gratification. So those are kind of like the ones that kind of lead into the door. And then we really work on skin health. So getting the skin healthy with microneedling or our estheticians doing chemical peels and or hydrofacials and things like that.
Got it. Okay. Now, you also provide wedding prep for brides as well. Could you talk a little bit about that?
Oh my gosh, yes. So this is the thing, this kind of fell onto me naturally, but with everything I do being curated, I always want to plan for my patients. So I'm always thinking, what can we do over the course of the year to get you to your goal? So for brides, it's really great because, budgets are an issue. We have a lot of goals. We want our skin to be glowy and feel our very best. So we really customize a plan for our brides. We kind of go through how often you'll do your treatments, when we want to start that timeline to really make sure your day is perfect and we don't have any skin issues close to your big day.
Nice. Okay. Now, are there any new or emerging treatments that you're particularly excited about?
Yeah, so right now we do a lot of microneedling, which I've always been a big fan of. It's one of my favorite treatments for just general collagen stimulation. But there's been a new regenerative medicine treatment called Aerescence, PDGF, which are growth factors. So we are adding that into our treatments and think like something that can help amplify your collagen stimulation, right? Like who would not want that? So we've been placing that with our microneedling treatments and our Morpheus treatments and our laser treatments. And it is just literally like the next level. It's quite exciting. Patients are loving it and the recovery is so much faster than traditional, which I think makes a big difference in this world. I mean, in Atlanta, everyone has an event. Everyone has somewhere to go. So they're like, how soon can I get out of the house? So I just really love things that can help speed recovery.
Yeah, it's very fascinating because it seems like there's more and more practitioners that's bringing regenerative medicine into their practice, into their treatments. I mean, I think about 4 or 5 years ago, like regenerative medicine, it was a very, very niche thing. Never really heard about it in like medical spas, but now it seems like more and more are bringing it in. It's like, is that kind of how you've seen that progression when it comes to regenerative medicine into your type of treatments?
Yeah, because I think what we're really realizing is that while we can give you, obviously our Botox and our fillers and our injectables are going to give you instant gratification, but what is the plan long term? Like, how are we going to maintain those results? In regenerative medicine, especially with what we do, we're really thinking about your collagen and your skin and your health, and everyone wants to age as gracefully as possible. So it's just giving us more tools really to do that better for our patients.
Hmm. Yeah, now I want to talk a little bit more about kind of what differentiates your practice from others in the industry. I think the regenerative medicine is one part of it, but I think in
Yeah.
particular, it's your focus on natural looking aesthetics. So could you explain a little bit more about that?
Yeah. And so the way I like to say it, and I've heard this quote before, but the best injectables are undetectable. So that is kind of my approach is that I want you to look your best, but I want people to look at you and just go, what did you have? Like, you look great. Do you have a facial? Like, did you get some rest? But they can't quite put their finger on it. It's more of like you just look really good. And so that's what I focus on. I use techniques and modalities that will minimize bruising, minimize downtime, and really focus on like I said, fixing the things that bother us the most. Feeling tired in the under eye, feeling like we have lines around the mouth, or feeling like we're sad. Like that is my focus is more confident and like happy patients.
Mhm. And that's also kind of another thing I've been seeing is that it seems like there's more of a shift that your patients are looking for more natural looking results. They don't want to have the overdone look like that was popular
Yeah,
before. So I mean, is that something
right.
that you've kind of seen throughout your entire career, or are you starting to see like more and more people going in that direction?
I think it's honestly been a big part of why our industry is getting busier
Mm,
because at the beginning, everyone was seeing like obviously like the overdone. And so people would come in and say, oh my gosh, I don't want to have lip filler because I don't want to look like X.
mhm,
And nowadays it's like no one knows I have lip filler and I'm so glad. Like that is kind of the trend. So I think we've really opened the door for patients who may have not been as interested in aesthetics because they just thought it was a certain way that now they can realize that you can actually look really natural and no one really needs to know whether you had anything done or not. If you want to brag about it, please feel free, don't gatekeep. I'm here to treat patients, but we just want you to feel your best. Yeah.
yeah. I think that's a very interesting point you bring up as far as because it's shifting to that natural look and you're trying to get people that maybe would have never considered it before now getting into it. So, I mean, the
Yeah.
medical spa industry it has been growing fairly significantly over the years. And it's interesting because beauty's always been there. Like everyone always wants to be beautiful, but why is it medical spas which focus on beauty is now starting to grow so much? And I think that's kind of to the point you mentioned, it's the market. Like you're getting more people who would have never even thought about going to a med spa now is considering it because it's not a overdone look. It's just more of like a touch up in some situations, making it look more
Exactly. Yeah.
natural.
A more natural for sure. And I would even say that across the board. Like we see so many more of the millennial, like that younger patient. They're really interested in like self-care. So we definitely have seen that growth. We've seen growth in our male patient population, 100% treating more, especially here in Atlanta. And I just think it's because we're making it more of a normal thing. It's just a part of your self-care.
Okay. So when it comes to your types of patients, I mean, you mentioned that there's some millennials that are coming in, but if you had to kind of say you're across the board, like what kind of people are coming and seeing, like, is it like across the board, all age ranges from teenagers all the way up to their 80s? Like, kind of who are you starting to see more of?
More of, so I mean, we definitely see, I would say probably like 25 to 55 is like the prime population. We have what I call the prejuvenators. We're just working on little things. And then we have the rejuvenators, which we're really trying to work on anti-aging. So that's pretty much my sweet spot. But again, we're definitely seeing patients of all races, all ethnicities, and definitely more men versus it used to be primarily females.
Interesting. So now,
Mm-hmm.
when you get people coming in, especially kind of these newer demographics, I'm sure some of them maybe are not so aware of what's going into this. So how do you approach educating your patients on the services you offer and also the benefits of them?
No, absolutely. I think it really comes down to being a really good, and I think that's because I'm an educator by trade as a trainer, really making sure we educate on all fronts. I use all my social media platforms to educate and talk about the procedures, really explain risk benefits and why we want to do them and set the right expectations. And we really spend a lot of time on that initial consultation. I feel that that is probably the most important time I can spend with my patient is to take that first hour and really get to know know them and their goals. And then we're able to work on that plan for the year. So the next visits, it's more of like casual and just catching up and kind of getting those things done. So that's always been my approach, is take our time and really educate and make sure they know the why. And honestly, the way I love to talk about benefits is really a comparable, because I like to say, if you had a twin and your twin did absolutely nothing and we started on plan XYZ, in 5 years, you're going to look younger than your twin. You're going to feel better and feel more confident. Who would not want to have that opportunity to be more confident and feel their best? So that works.
I see. Now, when people come in, I'm sure there's some people that come in and they have different ideas of what they think they need versus what what they need. So what are some common misconceptions that you hear the most often about the treatments that you provide and your patients coming in?
Oh my gosh, yes, we definitely get that. I actually had one the other day. So what happens is they have like the image that they saw from a lip or from a treatment that was done, and they're like, I want this and I don't want that and I don't want that and I like this. And they just have a full list. And what I literally do is I sit down and I just explain that I've been doing this for a very long time. I'm going to study your anatomy, and your anatomy is going to dictate what is possible. We can only achieve what your facial balancing will allow. And if you don't have that anatomy, I can't necessarily create that in one fell swoop. Over time, we can make it look better as long as it's going to balance. But I really focus on that facial balancing so they can understand, like, you are unique. Let's focus on your unique features and make those shine and not try to make you someone else.
Okay. So once they do come in, once they do have that treatment, how do you balance between providing that relaxing experience for them, but also ensuring their safety and well-being?
Yeah, absolutely. So for me, it's a lot. The provider, it's our job. You know, I study anatomy a lot. I've done many cadaver courses, and obviously having a surgical background, I just have a little bit more knowledge. You know, safety is our number one priority. So if anything is going to lead down an unsafe path, we're just not going to do it. So that's really my focus with them. And I really want to set that expectation up front about those risks and those benefits, because there are sometimes things that, yes, it could look absolutely amazing, but there's a 50% chance we could have an adverse. Is it worth it? Not so much in an aesthetic standpoint. Versus a medical treatment, I would have that risk is much more onto the patient to decide if they want to proceed from, you know, livelihood kind of situation.
Got it. Okay. Well, I want to shift on a different track right now, since you're one of the top 4% of Allergan trainers. So I'm curious, how did you end up getting into the educator role?
Oh gosh. I think it kind of happened on accident, honestly. So I worked in a clinic and I was asked to help kind of mentor the other injectors in that particular clinic. So that was kind of like a natural avenue that I went down just by being asked. And I found that I really loved it. I really enjoyed kind of seeing that light bulb go off when they really understand when we explain something. They're like, oh, now I get it. And kind of watching them grow and blossom. And I think that turned into a position where the practice that I worked at actually offered me to move to their corporate office and become a trainer for them. So that's really when I was training all across the country for just one corporate office. Allergan took notice and they asked me to become a trainer for their team.
Oh, wow. So across all the travel that you've been doing, I mean, it sounds like you really love it. Like, it sounds like it's a very exciting thing. So,
yeah, it's exciting.
Yeah. So what kind of, like, you kind of mentioned you really enjoy like when that light bulb moment goes off for them. Like, aside from that, like, what's like the thing that kind of drives you to keep doing it, keep being an educator, and really sharing your knowledge?
Well, you know, I think it goes back to what we talked about earlier. You know, the industry is growing rapidly. We are seeing new spas open all the time. And for me, it's always about making sure that we are safe, because our industry is, you know, for the most part, PAs, NPs, and RNs are doing a lot of the injecting across the country. So the safer we are, the more we all get to do it. So for me, that's really one of the aspects, is that if I can help ensure that other people are being safe and all our patients are being taken care of, then that's a win-win. It's kind of what we always say, community over competition. We want to make sure that we can support each other and all grow. So that's really where that comes from for me.
Okay. And I think it's incredible what you do, because I've heard so many people talk about, it's like, man, like when I was first getting to this industry, I wish there was somebody who was there to help guide me, show me the way. Like, it's incredible. Like, I've interviewed some people and they're like, yeah, when I first got started, I'd have a patient sitting in the chair. I'd go to the back, look at a YouTube video on how to do this, and come back out and then do it. If I get stuck, go back and keep watching the YouTube video, go back and keep doing it. So So
Yeah.
I think it's incredible what you're doing and helping the industry to grow, but also, I mean, helping everyone be safe with it as well. So
Yeah, no, it's true. I mean, we honestly, when I started, none of this existed. We didn't have like the YouTube to go look at. We were just studying anatomy. And what we would do is just say, okay, we're going to focus on one area, one thing, and just be really good at it before I move to something else. And that's what I tell injectors now. I'm like, get really good at your toxin. Just make sure you focus on that and then focus on the lips later. Like, it's really important because the anatomy is so variable and it takes time to really, do it well. And so I think that if I could give one thing to new injectors, get yourself a mentor. Find someone that will help cultivate your skills and help you grow that aligns with what aesthetic you want, for your patients.
okay. Now, when it comes to the way that you approach patient care, I mean, when people think about medicine, in their mindset, they think that, okay, there's a protocol, there's a step-by-step process, like it's largely set in stone. But what role do you believe creativity plays in your approach to patient care?
Yeah, that's a great question. And what I would say is aesthetic medicine is where medicine meets creativity. That is the sweet spot. You have to have an aesthetic eye. You can develop it, you can definitely enhance it, but being able to see symmetry and balance and highlights and contours, it's kind of, I think of it like a makeup artist a little bit. Like you have to be able to identify that to know how to fix it. And then the anatomy and, the products and how those products work and how we select which product, that's the medicine. So putting it together is how we get that. And so that will take time. I know some people that are amazingly creative, but they have no concept on the medicine and vice versa.
Mhm. So you have to be a medical professional, and you also have to be a little bit of an artist.
Yeah, yeah. You need to have enough restraint so that you're not a maverick out there either.
Yeah. You can't be like Pablo Picasso.
Right.
Okay, now I'm sure that over your experience, you've had some particularly challenging cases that you've had to work on. So would you mind sharing like one story about a particularly tough case that you had and how you were able to get them a successful outcome?
Yeah, definitely. I think about one case. I had a patient, and I always tell people lips are the hardest thing that we do because they are so intricate and we look at symmetry so closely with the lip. But she came in and she had had a dog bite as a child to her upper lip. So there was this scar, there was healing, and she just really wanted her lips. They were very thin and very small, just to be a little bit better, just to have it. She was literally like, whatever you can do, I just want to do something. So, I had to go to the drawing board, with my anatomy, really making sure from a safety standpoint we could accomplish it. And when I tell you the tears in her eyes and then in my eyes afterwards, it was one of the most rewarding treatments. We just went really slow, we took our time, but it was such a beautiful outcome. And that gave me so much joy that we just made her that much happier that day and for as long as she got to maintain them.
Yeah, I think it's pretty incredible. Like when I ask you about what are some of their best success stories, the ones that really stand out in their minds, it's almost always going to be situations where someone felt like they had some type of deficiency and they just want to feel normal. And I think
Yes.
that's one misconception people have about the aesthetics industry and the medical spa industry. Being an outsider, they think, oh, it's just about vanity. You just want to look as beautiful as you can be. But
Yeah.
the stories that really resonate with the providers are always the one where it's someone had some type of issue before they got in an accident, they had some type of condition, and they just want to feel normal. They didn't want to feel like, they didn't want to the point where I want to be the most beautiful person in the world. I just want to feel normal. And I think a lot of people don't realize that that's a big part of aesthetics. It's just making people feel good about themselves, not necessarily trying to make the most beautiful person, but make them feel like that on the inside so it reflects on the outside.
Exactly. That's what I was going to say. 100%. We spend so many of our patients, so many visits in the room. That's where that magic is happening, the conversations we're having, and we're developing that. It's much less about the aesthetic. It's more about really just that confidence and kind of bringing that out of them so they feel like their best version of themselves.
Mm-hmm.
Yeah.
So now where do you think the future of aesthetics is going, Jen?
Oh gosh, to the moon. Honestly, I think that regenerative medicine is going to play a huge part in the future. I look forward to more injectable treatments that will rejuvenate our collagen and elastin and really make our skin firmer, tighter, brighter. And I think that is definitely on the horizon when I look at what clinical trials are happening now. We're going to see a lot more with regenerative medicine for sure.
Okay. What are your thoughts on like holistic medicine, more natural medicine? Like as I talked to some providers and they're kind of incorporating that into their practice as far as like a holistic viewpoint and everything. Like if your body is healthy, if you're good on the inside, then it will reflect on the outside as well. So I mean, what are your thoughts on that area of, I guess, medicine more holistic, more natural being introduced into med spas?
I think it's going to be really good for those that really want to specialize in it. I would say it's probably not for everyone. I always like to say I want to be a master of certain things, but I don't want to do everything a little bit. Like, I think that's where we can sometimes run into, like, I want to grab every patient. We just want to be really good at what we do. But I do find that there are definitely some that you can see their passion, you can see the drive and how much it means to them to focus on holistic. And I say, go for it. If that makes sense for your practice, you will find patients that align and your business will thrive because you believe in it.
Okay, great. Now, I have one last question for you, but before I ask it, I want to point people to your website at www.jcaestheticsllc.com. Now, last question is, what do you think is the most important piece of advice you can give to somebody who's thinking about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
So the first thing I will say is you really want someone, if you can, someone experienced. Get their background, interview them, find out their experience, find out how they got into the industry, find out what kind of trainings they're doing to maintain their skill set, and then really look at their before and after work. What you want to do is make sure it aligns with your goals. It needs to be a match for you, and everyone has different aesthetic goals. So just making sure that that's a good fit would be really important.
Okay, great. Well, there you have it, Jen sharing her expertise. So Jen, where can people contact you in your practice?
Yeah, they can contact me on the website or at Skin Lab Atlanta. We are a SkinCeuticals affiliated store here in Atlanta, and you can give us a call or go to our website, www.skinlabatl.com.
Great. Well, thanks for being on the show and sharing your message.
Thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.